Hi everyone, my name is Ilia Young. I'm a graduate of the College of Southern Nevada CHW or Community Health Worker certification or Certificate of Completion program, and sponsored by the Governor of Nevada, Governor Sisolak. I attended from August to October 2019, facilitated by Ms. Evelyn Thompson. I'm also the first CHW student awarded the live case study for our final case study. And right now, currently, I attend post-university in the Human Services Bachelor of Science degree program. I want to start by saying congratulations to everybody for completing your journey to becoming a community health worker. Sometimes it's about determination and making sure that you are in the right field for what you want to achieve with your life and for others. And this definitely is that, career leg up that some of us need. Um, I hope you've been able to use this time to make friends, acquaintances, and network, because this is it. This is where you network. So when I began the program, I wasn't sure what to expect. As a military spouse of 20 years at the time, I was getting ready to join my husband in retirement. And my job as a key spouse was a community outreach worker. So everything I knew, everything I had learned throughout the years, I was wondering how I was going to transfer that into the real world. And I stumbled upon the community health worker program. It was it was karma. It was sent to me. It was meant to be. My expectations of the programs were 115% over. Whether you're already trying to get into the field, or this is your opportunity to become a CHW, the program through CSN is a great way to get into the health services field. You've gained knowledge of mental health first aid, you've gained knowledge of your CPR certification, and getting started on becoming certified in the long run. This program is fantastic as it assists patients in diabetes, health, heart health, education, homelessness, um, addiction. There are many fields you can get it into. Of course, you will have to continue your certification process to be more knowledgeable about those things. But this is a great way to get started. So um, it's just what you do with what you've learned. So continue learning. It benefits you and your client. So now I want to talk about barriers that I found throughout my experience as a CHW. Um, what I found so far is the lack of trust that some health professionals have towards community health workers. We don't have a licensure like most of them do. We have field experience, we have everyday life experience. We are the community. So they may not understand that. They just think we're just some lay person that comes in and says, well, hey, I can communicate and I can do that. And it doesn't apply every time. We are also professionals that may be working in doctor's offices, or we work in insurance companies. So we have some information, we have something to give back. We have some experience that is relatable to the CHW program. So what I found so far is that sometimes you will need to have a certification as a CMA, or certified medical assistant, or LPN, the licensed practical nurse, or just have some medical terminology education as a background. And while these type of certifications are great to have in your background and towards your degree or your educational repertoire, um, it doesn't necessarily take away from being a CHW, but it takes away from the job that the CHW is meant to do. We are a field worker. We are not meant to sit behind a desk and wait for, the next number to come up to the counter and just take your information. We are out there in real time. We connect the patients the way perhaps a CMA might not be able to. Um, Other things that I wanted to discuss were the type of listeners we are. So you're taught throughout the CHW course that listening is just a very important part of what we do. It's when we go out into the field and when we're talking to these mothers, these fathers, these, the elderly, the grandparents, the homeless. Um, we need to listen. It's not about what we think they need. It's about what they know they need. So how can we help them achieve their goal? Do they know they have a goal? Can we help them kind of piece together, how to get what they need? And sometimes you will meet people that just, they want the help, but they cannot. We have those chronic medical people, and that's okay. Sometimes that happens, but that's why we're here. Um, we're meant to connect. We're meant to listen. We're investigators of our clients' everyday barriers of better health. So one of the things I wrote down in my notes was, we answer the whys of doctors, nurses, and in some occasions social workers' questions to why the treatment is not working, or why patients continue to visit the ER, when sometimes there may actually not be an emergency or a health related situation. Sometimes they just need someone to connect with. Sometimes they just need someone to listen, and just, you know, sometimes you feel like something hurts, but you're just lonely and you're afraid that it could actually be something worse than it really is. So that's what we're for. We're there. We are behind the scenes. Our doctors, our nurses, they prescribe, they treat, but they can't see why these treatments are not working for their clients. They can't see the barriers of their everyday lives. We go in and we investigate. We look, who's living with you? What's going on? Is somebody else here that's not supporting you? Are you going through another crisis that the doctor doesn't know about? These are the questions that we can get answered just by listening, just by looking, just by being there. Something that doctors, nurses, and sometimes social workers can't afford to give. So another barrier you might find is that it depends on how much we get paid, whether some people want to do this career field or not. If it's something that you're deeply passionate about, you want to help people, then you do it. You do it because it's important. And if you get paid for it, great. If you don't, you take the experience and you grow with it. And someday the CHW will be recognized, and hopefully soon, because I think it is important. Our population just keeps growing and growing, but the resources are not being utilized the way they should be. So, um, as I said, as I seem to be getting to, my experience as a CHW has been wholeheartedly rewarding. Following graduation, I networked with classmates and the neighboring class of graduates, as well as faculty, in search of opportunities. I found them in participating as a community heart hero. We worked with um, clients of congestive heart failure. The Heart Hero program was directed by Luz Castro, and with her, we collaborated with Dignity Health and the University of Las Vegas nursing students within their CHAMP program. As a Heart Hero, I had two nurses that would go with me, and we would talk to our patients, and this is something I advocate tremendously. If you can have a nurse, if you can have that network, of this nurse that can help you answer these questions in real time, um, do so. It's so important to have someone that can answer your questions right on the spot. It's just a text, quick, to the point, get the answer you need, give it to your patient. That way they're informed, you can get them the right information, and they can see their doctor and go with what they need, not with questions or, well, I think this might be what I need, or I don't know what I need. You can get that for them. So network with those nurses, get them to support you, educate them on what you do and why you're doing it. We're there to help them. We are there to help them, to help the bottom line of the hospital. The hospital spends millions of dollars trying to take care of their patients, and sometimes it's not enough to help everyone, because they have to treat these people that didn't need treatment in the first place. So we're there to prevent that from happening. And we can save the hospital a lot of money by doing that and actually treating people that need the treatment and using other resources to help the undeserved community that we're here to represent. So I did that for some time. Let's see. As a CHW, I was able to use the skills I needed to understand my patient, or my client rather, and I was able to lend the support that they needed in their journey of healthier lifestyle. Always remember, you're the eyes and the ears of the client's professional medical team. You're helping the hospital, bottom line, but you work for the patient. Um, Try to remember that one time when you might have been at the hospital and just you felt like you were not listened to. Somebody was not there. The nurses were just running around. There's an actual someone got shot on the leg and they need all the nurses they can get. Um, the CHW is there to help. The social worker is helping someone who has an addiction right now, but nobody's there to help you. So where do you fall? That's where we come in. So this program exceeded my expectations of what I would one day become. And because of this program, it made me realize that the field of work, my degree would be in human services. It's just branches into anything you want to get into. But human services is the one. And then later on, I would like to become or acquire my master's in social work. So this is a leg up. This is something you can do and really advocate for, or something you can use to propel yourself in order to help your community even more. Um, let's see. Before I leave, I'm ready to go. Thank you for listening. I wanted to say one more thing. Remember this Confucius saying: our greatest glory is not in never falling, but in rising every time we fall. If you think about that, we all fall at one point, and that's what we are. We're a lending hand. As CHWs, we are the lending hand to those who need it. Go with heart, and you will make a difference. So the hugs and thank yous are completely worth it. So don't give up on your pursuit of better quality of life, for all, for yourself, um, and always learn something new. So thank you for listening, and I wish you all the best on your continued education in health services and helping others. Thank you.